And welcome back. Well, heart failure is very common. HF, heart failure, is a chronic and progressive condition, and more than 6.5 million people live with it here in America. The symptoms are often mild and progress slowly, so it's often not recognized or treated until people are older. Here to help us reduce the risk is cardiologist Dr. Alan Gass and Good Housekeeping Deputy Editor Laurie Jennings. Good morning to both of you.
Good morning, Tiffany.
Good morning, Tiffany. Thanks for having us.
Absolutely. I think this is shocking to people here that they may have it for years before it's ever diagnosed when they're older. So let's talk about what heart failure is. How do you describe it?
So, Tiffany, that's why we're here today on behalf of Novartis and Good Housekeeping to help educate people about heart failure. As you said, it's a chronic condition. It's progressive, and it's due to the fact that the heart can no longer pump the blood around the body efficiently. The symptoms of heart failure can be very subtle, as you just mentioned. Shortness of breath, swelling in the ankles, fatigue, or it can be just that you can't do things that you used to do, or you try to avoid simple tasks like going to the end of the driveway to pick up a newspaper. The symptoms can stay stable, but they could also worsen. And especially, Tiffany, if you've been hospitalized for heart failure, that may be the opportune time to speak to your doctor about your medications. Because over the last few years, the options have expanded to include a breakthrough medication called Entresto, the first FDA-approved medication of its kind. And in a recent heart failure trial, actually showed that Entresto helped people stay out of the hospital and alive longer. And Tiffany, Entresto may not be right for everybody. If you have a history of angioedema or you're pregnant, you shouldn't take Entresto, but always consult your doctor about any medication changes. And it's not only about medications, Tiffany. Equally as important, it's also about lifestyle modifications. Laurie?
Tiffany, the other thing you want to think about, and what we try and share with our readers at Good Housekeeping, is that living a heart-healthy lifestyle, there are some fairly easy things you can do to live a heart-healthy lifestyle. And first and foremost, that includes eating a low-salt diet. So I like to tell people to eat the rainbow. You know, you want to get those dark leafy greens, those brightly colored vegetables and fruits, because they're naturally low in salt and they're also high in other nutrients. So you get those by shopping the perimeter of the grocery store. But even if you get into the inside aisles there, you know, before you put something in your cart, definitely check the label, turn it around and look at the sodium content, or look for things on the front of the label like low salt, no salt added, or low sodium. Those will also help you understand where there's less salt added to that food.
I think those are great things to know, and obviously the whole point is if you have some of these symptoms or you're worried about it or you have a history or whatnot, you want to stay out of the hospital. You want to be doing all the things that you mentioned. As you talk about some of those things, are there ways that we know that we should explore different heart failure treatment options than ones that you even mentioned?
Well, first and foremost, you have to basically do the lifestyle modifications and take the medications that are approved for heart failure. A recent heart failure guideline actually spoke to this, and if you're an appropriate patient with a certain type of heart failure and you're on medications like ACEs and ARBs, you could be switched to Entresto. So it's a great question, Tiffany, but you should always go with the FDA-approved medications.
And Laurie, how do we make the most of those doctor visits? Because as you both mentioned, sometimes you are ending up in the doctor and they're your partner in this journey to getting back to health or staying healthy. So how do we make the most of those visits to make sure that we live a long, healthy life?
Well, first and foremost, you want to make those visits and you want to keep those visits. So there's no benefit to making your appointments and then perhaps missing them or canceling them. So make your appointments, stick to the appointments, commit to those appointments. But then you may also want to prepare properly for those appointments. And that means writing down your symptoms, taking notes about things that are going on in your life so you can share that information with your doctor, because it's easy to forget things in the moment and think about it afterwards. Well, better to come prepared with notes, with questions written down, so that you can really make the most of that appointment. You may want to speak to your doctor about something like joining a support group if you need to share, or you want to share your journey with other people. I mean, you have your friends and family, but you really don't have to go through this alone. You can really reach out to other people who are struggling with the same challenges and talk to each other.
I love that, and I want to add to write down their answers, because you always forget in the moment what they say. Thank you both for joining us. I really appreciate it. Where can people go for more information?
Tiffany, thanks for having us, and they can visit Entresto.com.
Lovely. Thank you, doctor, and thank you, Laurie. Really appreciate your time.
Thanks so
Thanks,
much for having
Tiffany.
us.